How you doing? My name is Gianni. I'm going to be your student physical therapist today. So what we're going to be doing today is just a couple breathing techniques. If we have some issues, maybe with some mucus buildup or you have shortness of breath, just trying to calm those symptoms down and get back to normal, regular breathing motion and facilitation. So what we're going to do here is we're going to practice diaphragm breathing. So I don't know if you know what a diaphragm is, but that's going to be located just underneath. Is it okay if I?
Sure.
So it's going to be just on your stomach here. So you just place your hand on your stomach here. So what we're going to be trying to do is we're going to try to feel it with your hand of you breathing with your diaphragm here. So not trying to breathe from the upper part of your chest, trying to breathe from that motion here. So if you want to take a little sniff, you could feel that diaphragm pop out. Do you feel that pop out there? Okay. So what you're going to be doing here is when you take an inhale, I want you to feel that hand rise, and exhale, it's going to come down. Good. And we're just trying to breathe from that area there, trying to keep it to where it's there the whole time and not your upper chest. Good. We'll go one more there. Good. Does that feel okay? Yeah, that looked good. So in the case that maybe there was something where we couldn't get that, I could help facilitate that. And so what I'm going to do is I'm going to have my hand on that there, and then when you inhale, I'm going to rise with you. So try to keep it down here with the breath. Good. And then coming down, and I push down with it. So we're just trying to focus on inhale, my hand coming up, and then exhale, hand coming down. Good. Yep. And then that's just to help you if you had some trouble with that type of breathing, but that looked good. And then the next thing we're going to do is you can sit up for us here. So with that one, with the diaphragm breathing, that's if you were just using, like I said, some of your accessory muscles up here. And then if, we had trouble just activating the diaphragm in general, but that looked good. You did a good job. So the next one we're going to be doing is pursed lip breathing. So this is if you're starting to, have some shortness of breath and you can't breathe normally, like a full inhale or full exhale. So what we're doing here is you're just going to breathe through your nose. And then when you come out, I want you to pucker your lips and breathe out like that. Good. And then inhale through your nose and then pucker your lips. Good. We'll do two more. Good. One more. Good. And then with that, that's one of those, like I said, where if we have that shortness of breath, that's something you can use in your own time if you start to feel any of those symptoms. Okay? Good. Okay, so for this next technique, we're going to do a stacked breathing technique. So this is just something maybe where our lungs aren't expanded enough, we can't take that deep inhale in. So we're going to use this to help facilitate you getting that more expanded lungs so you can have a deeper breath through it. So what we're going to be doing is I'm going to have you take a full exhale, and then, so you're going, and then when taking breaths in, you're going to go through your nose or your mouth or both, but you're just taking a small little breath in. So, and then hold, and then again, hold, 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 hold until you feel like you can't take another deep breath in or take a breath in without exhaling. Then you're going to hold for 5 seconds and then take a deep breath out.
Okay.
Okay. Start with a big exhale. And then we're going to slowly, good, hold. Good, okay, so that's something, like I said, that we can work on that technique for something that if our lungs, we were having trouble taking a good inhale in as a breath, so that can just help facilitate and get the lungs expanded a little bit more. So the next technique we're going to do is the huff cough technique. So this is something that can help with if we have some mucus that is built up in your lungs. We're trying to get underneath that mucus, so we're going to try to breathe from our stomach and push that mucus out and out of our body so we can breathe normally. So with this, it would be something like, so you're taking, let's say you take a nice deep breath in, and then you're going to exhale forcefully. That's a cough, right? So with this, we're just going to do it a little bit differently. So we're going to do that first so you realize kind of deep breath in and then a forceful exhale out. But then the second time I want you to go, hold it, and then Okay, and I want you to try to exhale from your stomach. Okay, so breathing in through your stomach and then making that exhale out. Okay. So what I want you to do, like I said, is just practice making that nice deep breath in, and then forcefully exhale, making yourself cough. Good. And then, like I said, for this next one, take another deep breath in, hold, exhale. Good. One more time. Try to breathe from that stomach. Good. Okay. So that looked good. That's another something you can do with that to, like I said, get that mucus out of your lungs. And then with this one, we can also do, with the last one we'll do is an active breathing cycle. This is just to improve breathing control and then some secretion removal. So like I said, any mucus in that area as well. So what I want you to do is, what we're going to do is breathe normally for 10 seconds.
Okay.
And then after that, we're going to take big deep breaths in and out. We're going to do that 4 times, okay? So we'll do 10 seconds regular breathing, then 4 big inhales, 4 big exhales. And then with that, you're going to then do that, repeat it one more time. So 10 seconds normal, 4 inhales, 4 exhales.
Okay.
And then after that, on the last exhale of the big deep breaths in and out, I want you to turn to your side and do like a huff breath to the side, okay?
Okay.
And that'll be at the very end, so it's the last thing we do.
Okay.
So we'll start with just 10 seconds breathing normally. Good. Now 4 big deep breaths in and out through your mouth. Good. 10 seconds. Okay, then 4 more big deep breaths in and out. And then on that last one, we're going to do that huff breath where it was, but turning our head to either right or left, whichever one. Good. Perfect. Okay, Christy, you're doing really well. We just got one more thing today, okay?
Okay.
So what we're going to be doing is another thing for drainage of the lobes if we had some drainage. So let's say we had a little bit of buildup on left side of your lower superior lobe of your lung. So I'm going to have my hands right here, okay? So in this position here, and what I'm going to do is I'm just going to have my hands cupped, and then I'm just going to be having like a percussion on that area, okay? You're just going to breathe normally throughout, and then I'm going to perform this for 5 minutes, okay?
Okay.
So what I'm going to be doing is just, like I said, cupping my hands, and it's going to be on your, so we're dealing with your lower lobe on the left side and the superior, so the upper portion of it, okay?
Okay.
So just breathing normally. And then I would do that for 5 minutes, and then hopefully that clears some of the drainages in that area. We can also go on different portions of the lower lobe as well, but for this portion, like I said, we're doing the left superior lower lobe of her body. But like I said, with that, we're just working on getting that drainage out. So just another form of doing that and just seeing how it works, okay? Everything good there?
Yep, thank you.
Awesome. Good job.